going to start producing a clear, what they call pre-ejaculate. Now, we males have one opening for both the urinary system and the reproductive system. You females have two separate openings for that, all right? And so, when we urinate, urine's supposed to be acidic, depending on our diet. Sperm don't like acid, and so as we males get aroused, that bulbourethral gland, or the Cowper's gland, turns on, which produces this clear fluid, which is basic, it's alkaline, in order to neutralize the acid in the urethra, so that we don't kill the sperm before they cause us to spend money on child support. All right? Why do we need to do that? Also, the vaginal canal is pH of about 3, ladies, so the vaginal canal is acidic. Why do you want an acid canal? Basically open to the outside. You want it acidic to kill the creepy crawlies, including sperm. All right? But this cat and mouse game that we've been playing since, I guess, we've evolved, we also not only use that alkaline fluid to buffer the spongy urethra, we also use that fluid to buffer the vaginal canal, to give our little spermies a chance to impregnate you so you can take us to court and make us pay you child support for 46 years. All right? You're definitely going to see this model again. I can ask anything about the spermatic cord. I can ask about the epididymis, which is right there, testis, scrotum. All right? There is one model somewhere in here that actually shows the prepuce, which is the foreskin. Ah, here we go. Just this half of the model, not the other half. All right? Now this is the other half of this model right there. This model shows you only this half, the glans penis, without the turtleneck. The turtleneck is on this part. We don't call it a turtleneck, we call it the prepuce, all right? Or the foreskin. Now some fellas still have theirs, other fellas do not. So they've got a crew cut, all right? Why is one way and the other way? I get this question frequently. People get embarrassed to ask. It can be religious. I believe the folks of the Jewish faith are circumcised. Also, Muslims believe in circumcision. Oddly, in Europe, I believe the percentage of circumcised males that are non-Muslim, non-Jewish, 1 to 7% of males in Europe are circumcised. Everybody else, uncircumcised. Here in the United States, I'm going to lie to you, I think the number is somewhere to 40%, somewhere around there. I don't really know the number. Back in the old days, 40s and 50s, the medical field said that males that did not have a circumcision increased their chance of getting penile cancer so many-fold, so they tended to force the parents to go ahead and have a circumcised baby boy. Traditionally here in the U.S., if dad's circumcised, their son typically will also be circumcised as well. There are issues where people say a circumcised male will not have the same feeling as an uncircumcised male as far as the sensory portion of intercourse. All sorts of things are out there. Believe whatever you want to believe. However, in order to prevent that prepuce from fusing to the glans penis, males have oil glands under there that produce oil. Now that oil is going to be in a nice, warm, moist environment, which will be a playground for what? Bacteria. So women that have a sexual partner that is not circumcised tend to have higher rates of infections in the nether regions, because guys, well, we have to keep that clean, pull the skin back, clean all that stuff off, and technically, according to the experts, you males should do it twice a day, we males, but we males might be lazy. If we don't clean it, then this white cheesy substance forms called smegma, all right? You females can also develop smegma. We'll talk about that here in a moment when I grab another female model. But this model shows the prepuce. If I point to it and you tell me glans penis, the glans penis is this part, which is going to be right inside of the prepuce, all right? Inside of the turtleneck. All right. Females. Here's a female model. You females can also get smegma. You do have a clitoris, which is analogous to the glans penis of the male, just there for sensation, that's it. And just like a male has a foreskin, the female has a foreskin. They call it the clitoral hood or the clitoral prepuce, all right? Now, in some countries, they believe in removing the clitoris of females because, since that's the sensory part, sex for a female should not be pleasurable. They consider that to be a sin. So they do female circumcisions, they cut that out, which creates all sorts of issues. All right? That's it for that. Take a look at that and we'll move on. You might see this model. Why? This model shows kidney, ureter, bladder, penis, spongy urethra, prostate. On the back, seminal vesicle right there on the posterior aspect of the bladder. All right, so the seminal vesicle is going to be fair game on that one. Female with a little termite inside of it. This model you will see. Vaginal canal. All right. You've got the cervix, which is the inferiormost aspect of the uterus. This is all the uterus. Here's the fundus. This is the body. There are 3 layers of the uterus. The endometrium, the myometrium, and the perimetrium. All right? Make sure you know those 3 layers. The myometrium will be the muscular part. The endometrium, a portion of it gets shed once a month in females of reproductive age. All right? Then you've got the fallopian tubes, which are going to be right through here. They're also called uterine tubes. And then you've got the ovaries, which are going to be here and here. All right? You'll see that model most definitely. There's another model, the same thing. This model you will definitely see. This again shows the same things there. The vaginal canal, the cervix, body, fundus, all of this is the uterus. We're going to have the endometrium, the myometrium, the perimetrium, the fallopian tube. Right here, these finger-like structures are called fimbriae. All right? Notice that the fimbriae is not going to be attached to the ovary, attached directly to the ovary. It will have one little suspensory ligament, and that's it. Now, females, at a specific moment, when ovulation occurs, shortly before ovulation, you release a chemical that causes those fimbriae to begin waving back and forth. As they wave back and forth, it creates an in current that once that egg pops out, that in current causes the egg to get sucked up inside of the fallopian tube. And inside the tube, you've got ciliated cells that will carry that egg towards the midline. All right? If you have intercourse 3 days before ovulation up to 3 days past ovulation, your egg that you've produced releases a chemical that attracts the sperm. All right? And so my wife every once in a while says, "You got me pregnant." No, you entrapped my sperm. Actual truth there. If you want a successful pregnancy, fertilization should occur in the lateral third of the fallopian tube. Why is that? By the time fertilization occurs, that embryo, that fertilized egg, starts to divide rapidly through mitosis. It has to be at a specific point in its embryological development in order to be able to implant in the uterus. Now, the closer to the midline that egg gets fertilized, the lower down in the uterus that egg will be, that fertilized egg will be, before it can actually implant in the uterine wall. 64% of all pregnancies in the United States end up as a spontaneous abortion. The female may not know she's pregnant. She may have an extra painful cycle, an extra heavy cycle. That usually indicates a pregnancy that isn't going to be successful. All right? It's kind of scary that 2/3 of all pregnancies end up in spontaneous abortion. Most of the time, it's because the egg didn't get fertilized in that the lateralmost third. It got fertilized closer towards the midline. All right? So I can ask any of those questions there. Here's a mucus plug, I think. I can't look down. Yeah, there's a mucus plug. This is a successful implantation. Typically, you want that embryo implanted in the superior aspect of the uterus. The lower it goes, the greater the chance of a ruptured placenta, placenta previa, a variety of problems, all right? Now think of the